Many patients develop a negative attitude toward medication. Some see it as punishment for failing diet and exercise therapy. Others see it as a stopgap before surgery and its near instant results. Personally, I find medical therapy incredibly exciting, and here's why. Coronary artery disease is a progressive disease which for many of us begins in childhood when we begin to lay down cholesterol in our arteries. Now, vigorous diet, exercise, and medical therapy are the only ways we currently know of to potentially slow, stop, and even reverse the disease. It takes time and patience, but it is well worth it. Neither surgery nor angioplasty changes the fundamental progressive nature of the disease, while medical therapy does. Treatment is based on your symptoms, whether you've had a heart attack, and on your underlying risk factors. Near the top of the list of risks is your bad cholesterol level, also called the LDL. Stephen Nissen is a cardiologist at the Cleveland Clinic, a nationally ranked center of excellence.
Almost everybody should have an LDL cholesterol, a bad cholesterol of less than 100. And that if you're very high risk, if you have certain high risk features like diabetes and so on, you should be below 70 for an LDL.
Treatment should begin with diet and exercise.
For most people, a moderate heart-healthy diet plus an exercise program will lower cholesterol levels about 10 or 15%.
But if your LDL isn't low enough, drugs like statins can make a remarkable difference.
Statins have been shown to reduce the risk of heart attack and stroke by about 25 to 35%.
One of the biggest benefits of statins is preventing plaque rupture, which may be why your risk of heart attack decreases soon after taking statins and before your LDL has decreased much. Raise your good cholesterol, or HDL, considered as important as lowering the bad. Raising HDL is important since it helps clear cholesterol from your arteries.
Exercise raises HDL, or good cholesterol levels, lowers triglyceride levels, and it fights the tendency to develop diabetes.
Prescription strength niacin raises HDL as much as 30%. An often overlooked risk is an important blood fat called a triglyceride. Reduction of poor quality carbohydrates in your diet and medications can decrease triglycerides. Blood pressure is often undertreated too.
The main reason is that there are more side effects from the blood pressure lowering drugs. They're harder to administer, and you may need 3 or 4 drugs in some patients to control blood pressure.
Both diabetes and obesity can make heart disease dramatically worse, a big part of why so many of us are losing the battle against heart disease. That's why their management is vital. And if you've had a heart attack, there are a range of drugs your doctor should discharge you from the hospital with. A recent study showed even good medical centers may forget, so be sure to remind your doctor. They may include drugs that make your blood less likely to clot, like aspirin.
If you've had a heart attack or you've had an angioplasty, everybody should be on low-dose aspirin.
And a drug that can help your heart remodel.
If the heart muscle has been severely damaged by the heart attack or even moderately damaged, our guidelines recommend that a class of drugs known as ACE inhibitors should be given.
Others on the checklist include beta blockers, statins, calcium channel blockers. What can you do as a consumer? Make certain you hit your numbers, just like a report card, that your blood pressure, weight, blood sugar, and cholesterol numbers have hit the numbers suggested by your physician. Remember, heart disease is a progressive process. The only way of beating it is to undertake a lifelong program of medical therapy coupled with diet and exercise. It's well worth it.